Hi, everybody. It's Karen Anderson here with Aortic Hope for our week in review. Look, I'm just turning down the volume on my phone so you don't hear it when somebody decides to call me. Hey, so excited because it's Aortic Disease Awareness Month. Look, some people decide to have an awareness day, others decide to have an awareness week. There's way too much information to hold it only for one day or 1 week. We got to have it for a month. I got to turn something off here because I see you staring at me, Josh, and it's throwing me off. Thank you. Again, then it makes me, I don't know where I'm looking. All right. So yeah, tons of information. So super excited to get all of this information to you and share with you some little prizes and goodies. If you had caught my little video I posted a little bit ago, then you'd know if you join me today, chat with me, I'm going to give away bracelets. I got a lot of bags of bracelets. So if you want a piece of swag for free, something that could start a conversation about aortic disease, we'd love to get that to you. It is a fact that aortic dissections are rare. Statistically, they are rare. I know for those of you that it's happened to in the moment, you don't really think it's rare, or if it's happened to your loved one because it's involved in your life, but they are rare. And aortic disease is much more common than anyone realizes, which is why it's so important to think about your family and think about your aorta and think about who needs to go to the physician, and let's determine who needs to be monitored. Let's see if we can get a diagnosis of aortic disease before the rare aortic dissection occurs. It's so much easier when you're not having an emergent event, right? I think we'd all agree to that. So let's learn a little bit about the aorta, and let's get started with thoracic aneurysms. So I'm looking to see, I feel like there could be another post that maybe I'm missing. Josh, while I'm doing this, if you can check and see if I'm missing Aorta 101, I don't think we talked about that, or that could be Tuesday. I think I could be, yeah, I think I'm missing a post. I'm going to go pull that up, you guys. I'm pulling it up right now because it's important for you guys to see it in order, right? It's important. It's just my technical difficulty. So just here it is. I got it. We're good. Missed one. Let's start with what the aorta is. That's super, super important that we all have a clear understanding. All of this information that's medically provided to you from us is written and created by our two medical students, Samantha Cullen and Adam Ahmed, as well as he was a medical student, but he's now a resident at Cedars-Sinai, Duke. I believe I'm pronouncing it Gow. I believe I'm pronouncing his last name correctly. I probably should have asked him that over the last year or two, but just then came up in conversation. All right. Thank you so much for joining us for a day about the aorta. It is Aortic Disease Awareness Month. This particular post is from Adam. He's a fourth-year medical student and kind of helping us out with these posts. So we're going to go over the aortic anatomy. If you've not done so already, please download your free copy of Aortic Dissection, the Patient Guide. It's free for you to download. It's free for you to sign up to receive a hard copy, and it costs you nothing or your physicians nothing to talk with them about ordering a bulk amount of 25 books per box, so that they can then pass these books out to their patients and the caregivers. And while that's for dissections, we do have our second guide. It will be coming out in 2025 early, called Aortic Disease, the Patient Guide. Let's keep going. Sorry, I digress. Let's look. Here we go. The aorta. This is your aorta. It is like the largest vessel, taking all of your oxygenated rich blood to everywhere. That's the easiest way to say it. It's going everywhere. So if we take a look at this candy cane shaped organ, which is what it is now, even though we all knew it to be a vessel, we start off with what's coming out of the heart and going up. That is your ascending aorta. It curves around and has three main branches that provide blood to the arms and to the head, and that would be your aortic arch. As it works its way down, it is now descending. That is your descending thoracic aorta, and that's thoracic because it's in the chest. There is a part where it's called the suprarenal abdominal aorta. It's right about after the diaphragm, and now you're into the infrarenal, which is after the renal arteries, which provide blood flow to your kidneys. And then it goes into the iliacs, which provide blood flow to your legs. And all of this is giving blood flow through other little arteries to your abdominal organs, your pancreas, your liver, your spleen, your intestines, the whole entire 9 yards. So it's the largest artery in our body, and it's an integral component of our cardiovascular system. Its function is to take blood that has been oxygenated by our lungs and to deliver it throughout the entire body. It's just this amazing thing, right? It helps perfuse every single organ, including your brains, your abdominal organs, your kidneys, and all these other tissues. The aorta is very resilient. It's a resilient but flexible vessel, and it has elastic, smooth walls that allow it to widen and to contract as blood travels through it in different volume loads. It has 3 major sections, like we talked about: the ascending, which begins at the level of the aortic valve. It has the aortic arch, which when it takes that cane-like turn and starts to curve, and it has the descending aorta, which that's when it starts to travel down through your chest and your abdomen to reach the lower half of your body. Keep these divisions in the back of your head, because we're going to refer back to it as we start to discuss some of the different disease elements that can occur throughout the entire aorta. Let's talk about the layers of the aorta. To the naked eye, it looks like it's just one tube, right? It's just a tube. But when you look at it cross-section, there's actually 3 main layers to the aorta. You have the innermost layer, which is called the intima, innermost. You have the middle layer, which is the media, and then you have the outer layer, which is the adventitia. So 3 layers, but when it's wet, it's kind of like working with wet tissue paper. Okay, so these 3 thin little layers make up this vessel, which if you saw it in your chest, it's actually quite large. It's startlingly large compared to what you look at when you see your veins and stuff in your arms. It's very large. The different layers of the wall. So the tunica, and that was through a cross section. Intima, the innermost layer where the blood passes through, it contains special endothelial cells, which can actually help move the nutrients in the blood. Think intima, think innermost, okay? When people get intimate, they're very close, innermost, okay? See what I did there? All right, tunica media. So this is the middle or smooth layer, the smooth muscle layer, which has elastin and it has collagen, and it has, it basically helps in providing strength to the aorta and the flexibility. So think media or middle, okay? Then you have the tunica adventitia, and I could possibly be butchering words. That's the fun of me reading what somebody else writes. So that's the outermost layer of the aorta, and it actually helps anchor the aorta to its surrounding structure. It is where the most of the strength comes from. Most of the structural strength of the aorta comes from the outer layer or the adventitia. Knowing these layers are going to be very helpful when it comes to discussing some disease elements that can affect the aorta, such as aortic dissections and aortic aneurysms. Let's also talk about the aortic valve. It's a very important thing to consider when you're discussing the aorta, would be the aortic valve. And this is what a normal valve looks like. This is what it looks like when it's closed, a cross section of the aortic valve. It's got 3 little flaps here. Those are called leaflets. You're supposed to have 3. You're supposed to be born with 3. Doesn't mean everybody is, and that's where we start to have some issues, okay? This is what it looks like when it's actually open. So it kind of does this, yes, and it makes that sound effect. Sound. Opens and then closes. Opens, closes, okay? The valve is actually responsible for the opening and closing as the heart pumps and helps prevent leakage. Helps prevent the blood from leaking back into the heart, otherwise known as regurgitation. So you might hear your doctor describe the aorta as having a tri-leaflet valve, which actually refers to the 3 flaps of that valve that open and close when the heart beats. Do be mindful, however, some people are actually born with only 1 leaflet. That would be an uno leaflet, I think that's what it's called. And a lot of people are born with 2 leaflets, and that is called bicuspid. 2. That's where we hear the terminology of bicuspid aortic valve disease, okay? And most rarely, people can be born with 4 leaflets. I can't even picture how that's positioned, but that's a quadracusp. Having 4 leaflets is a quadracusp aortic valve, which often requires monitoring. Either of those, any of those will require monitoring and correction at some point to kind of help the heart function normally. Those are things that you are born with. That would be considered a congenital heart defect. It's not something that you get as you age. You're either born with a normal heart valve or you're born with something that's a lot more interesting. Okay. It's not something that happens over time. You can't do something to yourself to create this. But the 2 most common diseases that can impact the aortic valve would include aortic stenosis. So stenosis means that it becomes tight and it makes it hard for blood to leave the heart because it starts to become rigid and can have, I believe it can have like stuff on the inside. So it just kind of compresses it in the inside and makes it smaller, the area space for blood to travel. Okay, so that kind of makes it a little bit difficult. Or as I mentioned before, aortic regurgitation. And so that's when the valve becomes too leaky. And some of that blood will actually leak back into the heart with every single pump, which adds strain to the heart. And that's when the leaflets just don't come together to close it. There's a gap. They get a little flappy in there. And so you don't want that to happen. So that was all I wanted to bring up from the first one. There's a lot of links in here that you can look at, but it gives you a good sense of the overall anatomy of the aorta and of the valve. Okay, that's a great way to start off Aortic Disease Awareness Month. Any questions? No, kidding.
Good job. Hi, Velda. Velda says,
Hey, Velda.
My adventitia was dissecting when the surgeons opened my sternum. Yikes. The surgeon gave me a 15% chance to live.
Ick.
And I said, what a way to make it through, lady. And she
I know.
said,
what a way to make your presence.
Right? I guess
Hi,
that's why they were calling me a miracle. And I said, emergency, life-threatening surgery. I would agree.
Yeah. Oh, absolutely. Absolutely. Yep. Ding, ding. Velda's getting a little bracelet. Nice to see you here with us, Velda. All right. We're moving on to what makes sense. The thoracic aortic aneurysm, because we know these dissections are rare. They're kind of almost considered sometimes a complication. If people had an aneurysm, and a lot of people, as we know, wouldn't know that. So if we work backwards to figure out through diagnosis and through knowing your family medical history, what you might be susceptible to having occur on your aorta, let's talk about the thoracic aortic aneurysm, okay? Because I think a lot of us have heard of abdominal, and we will get to that, trust me. Let's talk about thoracic aortic aneurysm, or TAA. When you hear people say ascending aortic aneurysm, please do not use the acronym AAA, because in the medical world, AAA refers to an abdominal aortic aneurysm. So just say ascending or just say TAA. All right, just makes it a little bit easier. All right, comes another day of aortic disease awareness. And yesterday, or just a minute ago when I read it to you, we were given an overview of the structure and function of the aorta. So here's a trivia challenge. Which layer of the aorta, the intima, the media, or the adventitia, provides the greatest strength? What do you think?
I'm gonna blame Velda for distracting me with fun chatting.
Oh, okay. Well, then you lose. I will tell you, it is the outer layer, the adventitia, is the strongest layer. And watch, I'll be wrong. But the answer is not here, thanks to Adam. We'll find that out, I guess, in a few minutes. All right, thoracic aortic aneurysms. So let's talk about this a little bit. Here is your aorta in this picture here, and this is your diaphragm. So this comes up underneath your lungs and under your heart. This actually separates the thoracic and abdominal cavities. This is where the delineation is, all right? Okay, so you can have an aneurysm of the thoracic aorta, which would be after the arch, but it's still above the diaphragm. That is your aneurysm. Look how big that balloon structure is. That's in the thoracic upper chest. That's in your chest area. That is an aneurysm. You can also, but that is that's your thoracic. And this above that, right above that, is your descending thoracic. These doctors make it very difficult by having to like separate everything, but now things are separated into zones. And the reason why they separate them into these zones specifically for each area, like a zone of the root and a zone for ascending and a zone in the arch and a zone in the descending thoracic and a zone in the thoracic. See where I'm going with this? Is because these disease elements have a couple different nuances, a little difference in how they're going to be repaired or how treatment happens. They're typically diagnosed the same way, incidentally, with an echo, because you can still get some of that in an echo above the diaphragm. You're going to mainly get the arch and the ascending, but you're definitely going to see this in an MRI or a CT scan. So if you're having that because you think you might have pneumonia, it will pick up if you have an aneurysm in the thoracic area, whether it's descending or in the thoracic. And then this, of course, is an aneurysm in the ascending, because we talked about it coming out of the heart and it's ascending upwards. And that's where a lot of individuals who have had dissections end up having the aneurysms that they have them. This is a really key critical area. This is a little precarious. This is emergency surgery right here. Okay, it's typically always going to be a surgical treatment, and the rest of this, there's a toss-up. There's a toss-up. There's now a new device. We saw Dr. Caterino from Cedars-Sinai discuss it. What they're realizing now is for people who dissected in the ascending and then it went all the way down. Okay, that's a type A. Just we used to say type A, residual B, but it's A, and it's just an all the way dissection. They would just repair the ascending and just kind of leave the rest of it medically managed, because it's already time consuming surgery, and they've learned statistically, just leave well enough alone. Let's get the highest volume of blood that's coming out of the heart, which is at the ascending. Let's take care of it. And now what they're seeing is if they're going to have any issue with the branches of the arch, they can give you a graft in the ascending that goes through to the arch, includes branches if necessary, but then has a product that is a graft that goes into the descending thoracic. So it's one piece. It's one piece of equipment, and they're doing this right off the bat versus having that whole section be medically managed in here. So it's very interesting stuff. I think we'll be hearing some more about that. But this gives you an idea on the types of areas where you can have a thoracic aortic aneurysm. So an aneurysm is a bulge or a ballooning area within the wall of this blood vessel, and it can cause it to dilate or get larger and stretches to a larger size than its normal width. And the major concern when an aneurysm happens is that the vessel can lose a lot of its natural strength and ability to accommodate different blood volumes, and it can rupture due to the instability. So again, we often think about a garden hose and just the wear and tear of hitting that hose with a lot of pressure. Typically by the end of the hose is where you might find it getting a little bit larger over time until it could possibly just rupture. So if you didn't want it to rupture, you'd probably wrap it in duct tape, because everybody uses duct tape for things. It's kind of like thinking about using a graft, right? It's kind of almost the same, but not really, but kind of. So aneurysms of the brain and the heart actually carry a major risk and would require careful screening, long-term monitoring, and care by your doctors. Again, let's talk about a TAA, thoracic aortic aneurysm. That's any aneurysm that's in the thoracic component of the aorta, including the ascending aorta, arch, or upper part of the descending up until the diaphragm. That's all thoracic. Be sure to refer to the first post, which happened earlier in that week, the day before, when we discussed the different regions of the aorta. And here we go again. We've got the valve that goes to the left ventricle of the heart. We have the ascending, 3 different branches in the aortic arch, and this is all descending. Descending thoracic up to the diaphragm, abdominal, all the way down. Okay, it goes down to the abdominal. All right. The easiest way to understand why a TAA might occur, is because you have a weakened area in the wall of the artery. That's why it's going to occur. I suppose it could occur also due to trauma that ends up weakening the area, but it's when the aorta is subjected to an increased strain or pressure for extended periods of time. Now, remember, this doesn't like necessarily mean exercise. Exercise is good. It means when you add in genetics, being overweight, high blood pressure, things of that nature. Now, this is extra. We don't want our aortas to be extra. This is not a time when we want them to be extra. Okay. The most common cause of a TAA is atherosclerosis. Say that with chewing gum in your mouth. Bet you can't do it. And that actually refers to the accumulation of fat or calcium deposits within the innermost lining or the intima layer. And this can cause damage to those beautiful endothelial cells that we talked about, which creates the smooth muscle and allows the nutrients and the oxygen to flow easily. It's also strongly associated with connective tissue disorders such as Marfan syndrome, Ehlers-Danlos, and Loeys-Dietz syndrome. Patients with Turner syndrome, which are women or girls, are strongly associated with a TAA, especially at the aortic root. Other risk factors, as we just mentioned, would include high blood pressure, which would cause an increased strain of blood flow and blood volume as it travels through the walls. Smoking. Smoking directly damages the endothelial cells, so don't smoke. Tobacco cessation. It's going to get mentioned at some point. Just keep that in the back of your mind. Symptoms. Here's where it gets nice and tricky because they don't usually give you any symptoms. You would not necessarily know that you had this until they become large enough, which might compress a nearby structure, such as I think it would compress maybe your esophagus, not your trachea. I don't know for sure because I don't really know the entire anatomy. I don't really have that memorized because I'm not a medical professional. Again, just relaying information to you. But when symptoms do end up occurring, they could cause a little bit of pain in the chest or in the back, difficulty swallowing. Okay, the esophagus, I was kind of right. Or some shortness of breath. Okay, that would be trachea. Okay, so then I was halfway right. Some people might describe like a beating mass in their chest, kind of pulsates, they think. That's what they feel. It's not going to be with something that is smaller. So when you're told you have a mild dilation of the aorta at 4.2, 4.3, 4.4, you should not be feeling this. You really shouldn't. And I would wonder if you were feeling something after, but you weren't feeling anything before you were diagnosed. Because that can sometimes happen. It could be really real that you feel it, but maybe you're feeling it because it's more in your mind and it's something that might be more psychological than anything else when they're smaller. Again, that all matters, somebody's body frame and all of that's a lot of considerations, okay? There's no one size that fits all in this scenario. Now, a rupture of a TAA is a medical emergency, okay? It will present with sudden onset of pain, sharp pain, but that doesn't mean that it's going to be horrible pain. And it's going to be in the typically in the upper back and travels to the back and downwards. There might be a sudden drop in blood pressure, which might cause you to be dizzy or maybe pass out. Again, this is common, but not necessary for everyone. I didn't feel any pain in my back. I thought I had a little bit of reflux. I had a snap in my neck on the right side. So if I had known about this ahead of time, I wouldn't have gone to the hospital. I would never have thought it was this because they specifically continuously talk about a certain set of symptoms. Dizziness, sure. Felt like you're going to pass out? Yeah, maybe, because I wasn't really sure what I was feeling. It was new. I think a lot of people end up having an instinct about this and they just know something's not right. And a lot of patients have said that they feel this overwhelming sense of doom and gloom. All right. Diagnosis, management, and treatment. So to diagnose a TAA, a doctor is going to actually have to order a series of imaging, and they need an opportunity to try to visualize it from being outside of your body to kind of look at your entire aorta and determine if you actually have aneurysms. And this would include an ultrasound, could include a CT scan, MRI, and or angiography, angiography, right, to determine the size and the location of the aneurysm. we're going to have our resident Duke. We'll discuss all of this when it comes to these tests a later date and time. So we will get to it, I promise you. Actually, here we go. So this is showing you your layer of your aorta. And this is, I believe that this is part of the aneurysm. Pretty sure. This looks like it is a CT scan that you're seeing. Yep, CT scan. All right. Treatment of your TAAs will differ depending upon how big they are, obviously, and where they're located. So they also really need to evaluate your overall care and your family history. Because if you have a strong family history of dissections or aneurysms, if they determine that you do have a connective tissue disorder, then the treatment plan is going to probably change. This magic number of intervening at 5.5 will drop. It will probably be an intervention sooner. Again, there's a million different considerations. I'm not a medical professional. I'm only telling you the things that I've heard, but the numbers do not play the same for both categories of patients. So small aneurysms can just be monitored. You can get routine imagery, and you might have to take blood pressure medications. But depending upon your blood pressure, larger aneurysms can be repaired. And they're going to be repaired with either an open surgery or an endovascular procedure to ultimately prevent rupture, because that would be very problematic. And some lifestyle adjustments might need to be made to reduce your risk of a TAA. And that might be just management of your blood pressure, your lipids levels, which that has to do with cholesterol, maintaining a healthy, active lifestyle, and quit smoking. If you're at high risk for developing a thoracic aortic aneurysm, or you have a family history of one, be sure to always discuss your concerns and your questions and potential screening options with your physician. So that was the second day of Aortic Disease Awareness Month. Hope you learned something. I learn something every time. Hope you find it interesting.
So
there we
Velva
go.
had a guess.
Yeah?
She guessed media.
He didn't even give us the answers.
I know that. I'm just letting you know that she threw one in there.
That's a good guess. You would think in the middle would be strong, right?
I don't know. I don't know.
You know how I know logically it's the outside? Because people have dissections typically in one or both of the first two layers. So that outer layer's got to be your last saving grace. It is your life ring, right? It's got to be strong, because that's all you got left.
Yeah, that would be my ultimate guess.
Yeah, right.
Right, because I was just going to say the casing, but yeah, outer layer, I guess, is another way of putting it.
And tell me, when you think about that, how scary is that? It's like, great, I got this little teeny wet tissue paper layer that's like holding me together. I'm telling you, it's like Scotch tape. It really is. When you think about it, it's just, I find it all so very, I would find it even more fascinating if it wasn't happening to me. I really find it fascinating if it was happening to me.
Very interesting. I thought you said the second layer was the strongest. And then she says, I don't know.
I don't know either. Somebody go look. It's probably in that first day. Because I'm not going to pull it back up again. But 50-50 shot. Oh, nope. 33.3, right? Because there's 3 layers. All right, we're going to move on to information about abdominal aortic aneurysms, which are not discussed enough. And this is why there are some organizations that will cover, be there to provide support to anyone, of course, but their focus might be on aortic valve disease and the aortic aneurysm that's typically involved, which is ascending. Then there's organizations that might only want to focus on the nature of thoracic aortic disease. This is all valid, very valid. And I love that this delineation occurs in our community. We happen to want to provide education on everything and talk to everybody and anyone. I know it's a little potentially biting off more than you can choose, but I love it. We love it here. We welcome anybody who has aortic disease in any zone. Let's get together. Let's learn about it. And here's why. Just because you have a thoracic aortic aneurysm doesn't mean with 100% certainty that you are at 0 risk for developing one in your abdomen, and vice versa. Okay. Maybe if all you had was a bicuspid valve, you may not ever develop an aneurysm to begin with, period, end of discussion, right? But when it comes to aneurysms of a vessel, I'm not too sure that at that line at the diaphragm, that Harry on one side and Charles on the other side of each other, hey, like, no, you can't cross. No, you can't cross. You keep your disease there. Don't come over here. I don't think it works that way. So better safe than sorry. We're going to talk about abdominal because there's such a high number of individuals, mainly men, who develop abdominal aortic aneurysms. Huge, huge in this country, huge. Okay. Again, an aneurysm, a bulge, balloon-like structure that occurs in the wall of this blood vessel of the aorta, and it causes it to stretch to a larger size than its normal width. It doesn't matter where, that's what an aneurysm is, and you can get aneurysms anywhere in your body. The vessel, because it's being stretched, loses much of its natural strength and ability to accommodate the blood volumes, although there's not as much initial blood volume in the abdomen because the most blood volume is what comes out of the heart. But because it can't accommodate it, it puts you at greater risk for a rupture. That's not a good thing. So when you have a AAA or abdominal aortic aneurysm, that is a bulge that is occurring and it extends at the level of the abdomen in your aorta. Okay, so when an aneurysm forms, it can be at risk for dissection or rupture all the time. That's at risk for that. And that can be very serious and could be fatal. So here's a diagram of an abdominal aortic aneurysm. Here we go. That's where your aortic valve is. That's your root, okay, because your heart would be right here. Bonk. This goes behind the heart. This is towards the back, everybody. Maybe a lot of people think it's to the side. It's to the back. And here we go. And boom, we're in the belly. We're in the belly. And there it is. That's a big aneurysm. That's a big one. When you compare it, look, if you took the straight line down here, that's big, and it's going on both sides. It's not, I mean, this is no joke right there. In most cases, there's not going to be a symptom either here, which is crazy. So you're going to find out incidentally if you have one. However, but if it becomes large enough, well, then some people feel this deep, constant pain in their belly, pulsation near the belly button, or persistent back pain. So persistent pain, you might start feeling that. So if you're someone who is at risk to developing any kind of aneurysm because your family has a history of aneurysms and you begin feeling these symptoms, definitely talk to your physician. Make sure they know about your family history, which is why we say think aorta, think family, and let them then order the appropriate tests, which is typically an ultrasound. It doesn't even have to be a CT or an MRI. It can be an ultrasound with a wand. It is so non-invasive, okay? So the most common symptom of a ruptured abdominal aortic aneurysm would be sudden and severe pain in your abdomen, okay? A ruptured aneurysm can cause massive internal bleeding and it could be fatal, but it's not necessarily going to be as instant as if you had it happen right at the level of your heart because there's higher blood volume up there. So here's some causes and risk factors for a AAA. Atherosclerosis, and that is hardening of the arteries, and that's typically because of cholesterol and fat buildup and high blood pressure and blood vessel disease or trauma. All of those are things that can cause a AAA. But the biggest known risk factor of a AAA are anybody over the age of 65 and male. Those are your two biggies. Now you start adding in those other things I mentioned, and you're just thrown in the pot for a potentially not great recipe. Just things to think about. Other risk factors would include long-term smoking, high cholesterol level, boom, boom, put it in the pot of the recipe, add family history in there, sprinkle that in there, and you're at an increased risk of having an aneurysm. Diagnosis, because they usually don't have any symptoms, they get detected during a routine exam. The screening test is often done through an abdominal ultrasound. And in the United States, for men over 65 with higher blood pressure, it's going to be a free screening. And there's a lot of organizations, nonprofits, and companies now that are starting to do these types of screenings for free. It's so easy to screen for an abdominal aortic aneurysm that if you're under 65 and you have a family history or you have a known connective tissue disorder, you should be able to get screened sooner than age 65. Don't quote me on that. Don't go telling people that Karen said it. So I said should. I feel confident in my answer, but it said should. If the patient is known to have an abdominal aneurysm, then a CT scan is going to usually occur to have a better understanding of the size. Surveillance with medical management is typically appropriate when it has a diameter of less than 5.5 centimeters, which I know sounds scary to some of us that are so used to 5.5 in the thoracic being that magic number for surgery. It is different in the stomach. Again, blood volume is less. Sometimes the ones in the stomach tend to grow, I believe, slower. So the numbers, the ranges are a little bit different, okay? 5.5 centimeters for males and 5 centimeters for females. And this would involve taking medications to help lower your cholesterol and your blood pressure. And they need you to quit smoking because it directly does what? It impacts the endothelial cells. And if you can do those things, it will positively impact and slow down the growth of the aneurysm. And we are going to have a very interesting live event happening on the 12th. No, actually, it is happening. Oh yeah, on the 12th with Dr. John Martin. He is part of University of Maryland, and he's doing a lot of work with abdominal aortic aneurysms. And so this is going to be one of the first times we're really having a physician here to focus his talk about abdominal aortic aneurysms. And he has a nonprofit called Dare to Care that does some of these screenings for free in the community. So put that one on. If you click the like and subscribe button and the bell, you'll get notified so you don't have to try to remember. All right, so if an abdominal aortic aneurysm is large, like close to 5.5 centimeters, and it's detected before it ruptures, most people will be advised, let's think about surgery. And let's replace the aneurysm with a piece of synthetic material. That would be a graft, or it could end up, not a graft, a stent, okay? A ruptured AAA means it ruptured out of that third layer. Ripped right through all three, requires immediate surgery. And if you're at high risk for a thoracic aortic aneurysm or you have a family history for one, please be sure to reach out and discuss this with your physician and find out about your potential screening options. Think aorta, think family. Do not think one area can never impact another area. Do not. Put all your chips on red. You have a better chance. Just don't do it, okay? That is your abdominal aortic aneurysm post. And that live event is actually happening this Thursday. I keep forgetting I'm reading a week before.
You'll remember
That's
one
what
day. Molly
day.
says, hi.
Hi.
And then she says, atherosclerosis.
Atherosclerosis.
Laughy face, laughy
Did
face.
I say it wrong again?
No. And then she says, endothelial. Karen is on a roll.
Yes. Yes. I like saying these big words today. These I can read ahead of time without you guys realizing and think really hard. Pronunciation, enunciate, endothelial. Thanks, Molly. All right, let's move on. And next post got us off of some of this medical stuff and into where do you go now that you know you have one of these things, right? You want to know a little bit more about the community resources that exist. And there's a lot of them. Okay, so talking about what's in this visual right here, we discuss how Aortic Hope provides support and awareness and provides hope, creates some hope for patients and caregivers during the recovery and management of aortic disease. Rock from the Heart proactively educates people about aortic and heart valve disease, bridges the gap between impacted families and the support that they need, connects those diagnosed with vital resources, and inspires all through the healing power of music. That's how they do all of that with their twice-a-year symposiums and rock concerts they attach to it. If you have not been to one of these events, you need to go to Rock from the Heart's page and consider attending at least one of their events. She does them in February in St. Paul, Minnesota, and she does it in May, first weekend of May, in Fargo, North Dakota. And that was not that right accent. I tell you, it came out like a bizarre New Jersey accent. And then the Marfan Foundation Peer Support Network actually connects individuals with trained volunteers for personal support and guidance for those individuals that have a known genetic or connective tissue disorder. So whether you have survived an aortic dissection or you have been diagnosed with BAV or aortic aneurysm or a CTD, it can be very confusing with so many pages on Facebook. But there are many wonderful places to go on Facebook, and you have to be very cautious. A lot of pages, there's drama everywhere, people. I'm just telling you, and I'm going to keep all this drama inside myself. But there's a lot of pages where patients like to play doctor and they want to tell you what to do versus sharing with you their own personal experiences and their own journey and allowing you to learn how to advocate for yourself by communicating and educating your physicians on your situation. Please do not do what anybody tells you to do on these pages. If you're looking to get advice that's going to mirror or parrot what you want to hear, sure. If you want to hear people's experiences, go for it, but do not do what they say. That is not safe. There are some pages out there that will not share with the community when organizations like Aortic Hope are doing a live event and interviewing a physician where you have an opportunity to ask a question. They will not share when support group meetings are happening because they do not believe in patient-led support group meetings. There's a lot of organizations that just they use a lot of emotion to make decisions on guiding them on what to share that they feel is or isn't a valuable resource. We do not do that here. We share everything that we can possibly vet to allow you a chance to make the decisions for yourself. So what you see in this post is just a representation of what we have found out there. It may not be a complete list. Just want you to know that. There's a lot of 501c3 charities. There's a lot of just, and I don't mean just as negative, but they are not an organization. They are a Facebook page. So remember when Facebook shut down for like a hot 3 minutes, they would be gone. The charities and the organizations, the established businesses still run their business via their website or other forms of social media. The ones that are on Facebook will just be gone, unfortunately. So there is a huge list of resources. I'm not going to pull up everything now, but it's everything from A to Z on Facebook pages. Again, it's not a complete list. There are other pages out there, and it's basically, I believe, a complete list pretty much of the nonprofit organizations that work really hard to raise money to be able to provide their initiatives to you. And they all operate differently. Some do derive an income. Some have mixed volunteers and income, and then there's others like us that no one derives an income. We're not compensated for the work that we do to provide you what we do. So check all of that out, whatever aligns with you personally. I guarantee you there's probably more than one place that makes you happy, and we support all of your decisions. We just want to make sure that you're receiving accurate information. That's to help you find it all, and that can be found under our resources in addition to the fact that we gave it to you in a blog.
We have
That's what I got to say about that. We do. Who is it?
Kathy says, hello, I'm joining to listen in. Hi. Smiley face. I'm a watcher in quotes for thoracic ascending aortic aneurysm, getting another CT scan in January to check my abdominal zone to see if there is anything there.
Good. And, some people even get a CT as far down as their pelvic. Usually those are people who have had a dissection and if they dissected into the iliacs, but yeah, no, that's wonderful that they're on top of it. We call that scanxiety. When you have your scan coming up and it still makes you anxious. Can't help it, right? But it's good. You're on somebody's radar. It's the best position you could be in next to not having it at all. But then again, they're not symptomatic. So yay you, that now you and your physicians are going to be best buddies and they're going to send you for your monitoring and hopefully catch any changes. If there's going to be changes, who knows? There may never be a change. There really may never be a change. But at least if there is, they hopefully will find that for you. And yeah, so Kathy can get a bracelet too. All right, we're moving on to Survivor Series featuring Thomas Morgan. I'm going to openly admit, slap my hand, didn't have a chance to read it, but I do know Tom because Tom runs the Living with Abdominal Aortic Aneurysm page on Facebook. He's also part of Abdominal Aortic Aneurysm maybe awareness, some other page, 2 different pages. One starts with living with, one starts with abdominal aortic aneurysm, big supporter of the peripheral artery disease community, a member of the Way to My Heart, or the Way to Your, is it Way to My Heart or Your Heart?
It's the Way to My Heart.
Weight of My Heart, which is spearheaded by Kim McNicholas. We've had her on here before. She's had us on her show. Check that out if you're suffering from or have family members with peripheral artery disease. But he's an 81-year-old triathlete,
Iron
Ironman.
Man.
A better I can't say I can say atherosclerosis, but I got hung up on vet. Pathologist, researcher, survivor of a AAA and PAD and several other medical mishaps. The account of Kevin's determination to get to the bottom of his medical issue through strong advocacy and perseverance, or no, it says persistence, allowed him to continue his quest to compete and place in the world championships. This was just last year. This is not an 81-year-old. I should look so good at 81. Please check it out. Check out his story.
He is fascinating. He's an author.
I'm sure he's been in the community for a long time.
Oh yeah, he is fascinating. I love the title of his book, How to Train for Aging. And something that I can't remember if we talked about it in there, because I've talked to Kevin several times at this point. He didn't learn how to run until he was in his 60s. And
you do have to learn how to run.
Specifically for his peripheral artery disease and so on and so forth. But he has it's just an incredible drive to make sure that he is getting the most out of what he can do with what he is doing now. He's an incredible person.
What you should do.
Yep.
I mean, I know a lot of people in the community get really offended and put off and scared and nervous when people talk about triathlon or even a marathon or even a 5K. You're not supposed to get upset if it's not something that you feel comfortable doing, just don't do. But people that do that and still work out with this feverish passion, they are talking to their physicians, you hope, and they are working with them to figure out how they can still live their very best life doing all of those activities. So yay them. If anything, hopefully they inspire you to do what you can do to the best of your ability, whatever that is. For me, it would never be running. My skeletal system cries. It knows better. So, not going to do it. It's like an earthquake. So it's not happening. But yay to those that do. That's what I'd say. Yay. All right. Heart Valve Disease Awareness Week starts next week, starts on the 16th. Very excited to be supporting Heart Valve Voice US as part of the Global Heart Hub. And here's some information we want to share. Heart valve disease, I'm not sure if you guys know this, affects millions of people globally. Yet, it can remain undiagnosed and untreated due to a lack of awareness and also a lack of obvious symptoms. Early detection and timely intervention can significantly improve outcomes and ultimately save lives. International Heart Valve Disease Awareness Week is dedicated to changing the narrative by highlighting the importance of understanding the symptoms, risks, and treatment options. While we're going to be focusing specifically on aortic valve disease during that week of September 16th, as well as aortic dissection, which Aortic Dissection Awareness Day is on September 19th, it's important to learn about other issues that can arise with your heart valves. It's very common to have regurgitation, trace amounts even in your mitral valve, pulmonary valve. I mean, this is normal. You got 4 valves in there. And I don't remember the 4th one, so let's not even go there. But check out Heart Valve Voice US or Heart Valve Voice in general when you have a chance. Check out what they have going on. But this is a big week coming up for them. We're happy to support. Okay, another post. Come on, all of you readers that love reading. Want some really great stuff to read? We have a patient guide, Aortic Dissection, the patient guide. Here it is. Boom, boom, boom. You know, if you just open up our website or you go to our resources or our Hope Shop, it's the first thing you see. It's also in Spanish. Download for free, order one for free. Talk to your physicians about ordering a box of 25 for free. The second guide, Aortic Disease, the patient guide, has been written. It is now being reviewed clinically. It is being taken a look at by some other patients and caregivers. Our goal is to have this book in print form by the end of first quarter of 2025, although we hope to have it in a downloadable format before then. So that is a lofty goal, but we're working towards it. American Heart Association provides comprehensive information about heart and aortic conditions. The National Marfan Foundation actually focuses on genetic conditions that can affect the aorta. The John Ritter Foundation offers educational resources on aortic dissection and genetic risk. They also helped contribute financially to the publishing of a mental health guide from a genetic counselor that's based out of Johns Hopkins, because not enough is discussed about mental health when it comes to health-related issues, let alone aortic disease. So if you're looking for a really good book to read, you should check out some of these books that have been written by community members. I love that. I love having an opportunity to share them. We just talked about our book, Dissected, Healing with Poetry, My Journey with 2 Aortic Dissections. This is the second edition. Love this graphic. It's written by Maria Trinidad Herrera. Maria is also a therapist, and she runs our Spanish support group meetings. That's another little tidbit. So she had her first aortic dissection surgery in 2009. The fears and questions became very overwhelming. The difficulty with the diagnosis, lack of knowledge of some of the medical professionals that were actually working against her. What could have been addressed with a stent or observation, if found on time, actually led to a complicated and dangerous emergency open heart surgery. And it basically forever changed her life. The psychological traumas after the surgery became daunting and led her to find a healing path, and poetry became her path. I am not great with poetry. I like Dr. Seuss. I like my poetry to rhyme and have a rate and pace. It's got to have a cadence to it. Her poetry, some of it does, but a lot of it doesn't. But it is very moving, very telling, very easy to read. And her poetry really fortified her strength in her most vulnerable moments. And she wants you to know that you're not alone. And you can basically just click on the picture, on the title. It takes you right to a place to order for any of these books. Okay. All right. Next up, Everyday Sinner. Sounds like an interesting title, right? Undeserved Miracles from an Unconditional God. This was written by A.G. Helms, and this is what she says. I laid there helplessly, looking at my beautiful husband's sobbing face as the surgeon said, you need to decide who is priority, your wife or your child. So it sure sounds like she had her aortic issue while she was pregnant. Life is such an amazing, wonderful journey, but at times it's like a badly paved road. You're traveling along and bam, hello whiplash, hello insurance claim, hello Route 44 half and half tea with lemon and the good ice. That's the crunchy ones that you've been waiting for all day, all dumped on the floor. Sound familiar? Our lives, she says, over the past 2 years have been more like a bumpy road. A bumpy jungle safari trail in an old Jeep with 3 partially deflated tires. I mean, you have to read a book when it's described like that. God and we beat infertility. God saved our baby and God saved me. A walking, talking, breathing hot mess. He had mercy on an everyday sinner like me. There are 4 cases of the world of pregnant women with type A and type B dissections with an aortic aneurysm. 2 of those 4 resulted in both the mother and the child perishing. People say we're walking miracles, but we say our God is a God of miracles. It took me 2 years to write this book emotionally and physically. It holds the most personal details of our journey, and I pray this gives you hope. I pray it encourages you to speak to your mountain, whatever it may be, with boldness and confidence. I pray that it brings you closer to Jesus Christ. I pray that you turn the last page feeling loved because, friend, you are so very, very loved. Whether you are religious or not, check out this book. If you just want something that's inspirational and you want to hear a story that may give you chills, this is a really, really good story. Okay. How My Ordinary Became Extraordinary by Terry Benson. It invites you inside her harrowing journey through one of the worst heart conditions possible. After waking up to find her life fractured by her condition, she fought to reassemble the pieces into normal life. But when climbing the stairs felt like hiking, Mount Everest, basically, and brushing her teeth became an actual accomplishment, it didn't take long to feel discouraged. This is the true story of Terry's recovery from an aortic dissection and the people and mindsets that pulled her through it. Whether you're standing atop your personal mountain or still scaling the cliffs, this book is for you. It's another good book. All right, Life and Death, a true story of surviving an aortic aneurysm and dissection by Robert C. Fisher. Imagine rising on a normal day, unaware that you have a rare, deadly underlying medical condition. Without warning, and excruciating pain crosses your chest. You barely make it from your living room to the operating room, but your body somehow manages to hang on narrowly, surviving what most do not. But surviving the initial incident is only the beginning as complications arise. This is the true story of Robert, who at age 55 experienced one of the most traumatic events of his life, an aortic aneurysm with a dissection. With less than a 5% chance of survival, Robert was one of the lucky ones. You might remember hearing about aortic dissections. It was what killed TV sitcom actor John Ritter in 2003 at the age of 54. Trying to make sense of his near-death incident, Robert spent many hours talking through what had happened with him and his wife, Carol. Those talks soon turned into journaling about it and all that he had to cope with. That journaling evolved into writing this book, and Robert wishes to bring awareness of this deadly condition. For those dealing with an aortic dissection, or for those interested in what life is like after experiencing such a terrifying ordeal, this book may offer you some insight. And finally, Miracle Man, Beating the Odds, Cheating Death by Scott Pribble. And he says, do you know anyone facing or has faced major surgery, illness, disease, or other life-changing personal or financial situation? Does that person need hope, inspiration, spiritual grace, and the sheer will to keep going? Do you know people who want to need to lose weight quickly yet permanently with minimal exercise? Well, the author Scott Pribble survived an internal injury that's 90 to 95% fatal. Actual statistics about aortic dissections are closer to 20%, and they go up additionally each hour. In this book, he describes his 7-year rehabilitation and comeback. Pribble also describes how he lost 50 pounds in 2 months. So if you are another individual out there that has published something or you're about to, please get in touch with us. We would love to showcase your work on our reading resources under the resource section. And just so that you know, material and information contained on this website is for general information purposes only. You should not rely upon the material for information or information on the website as a basis for making any medical, business, or legal decisions. A lot of good information there. It's always so fun to see people in the community, what they end up doing, like where they are later, right?
Right.
All right.
Velda says, Terry wrote an amazing book. I loved it and will read it again.
You should. That's awesome. Okay, good to know. Tell me if it's different the second time around. All right, let's talk about our events that we have coming up. Lots of events. That's why I bring them up every single week. We don't want you to miss any. Today is the 9th. La, la, la. We're down here. All right. We have our grief support group meeting. That is actually, gosh, that is already tonight, 7 p.m. Which is weird because I had it for tomorrow. So we have to look at that. It's tomorrow night. Wrong day. I was just, you know, when a wheel's going and then someone sticks like a wrench in it and you're like, oh, that's what just happened in my brain.
Me. I was like, wait, I have stuff tonight?
Wait, no, it's tomorrow night. It's Tuesday the 10th. It's always the second Tuesday every other month. Sorry about that mistake, everybody. Tomorrow, we are going live with Gareth Owens from ADA UKI, which stands for Aortic Dissection Awareness UK Ireland. He is like the Aortic Hope on steroids in the UK and Ireland. And I can't wait for him to tell you about everything that they're doing across the pond and the great messaging campaign that we're supporting that's coming out for from the World Health Organization on patient safety, and to talk about his huge event that he's promoting on Aortic Dissection Awareness Day with Global Think Aorta. I mean, we're in now, I think Aorta is in about 12 or 13 countries, just added Egypt. It's just growing and growing and growing. So members of Think Aorta US and Aortic Hope will be attending. I will be speaking with Ben Uniman at that event. We're just going to yik, yak, yik, yak, yik, yak. He's a ton of fun. Plus, anybody who talks in a British accent is just fun to listen to, and he'll take your questions also. Then we have our very first arts and crafts with Diane Bishop, an aortic artist. It's going to be so fun, you guys. I wish I had my Lola up here. But this class, we put the materials in. You just need to get a clay pot. You can get that from Walmart. I think it was $2.50, like 50% off than when you buy it in a nursery. You just need to get some paints. If you get black and white and yellow and red and blue, you can make any color under the planet, basically. And she'll teach us how to do that. One of the things that people don't really know about Diane is she is an accomplished artist. She's so crafty too. She does a great job at this stuff. But You need the paint, you need brushes, and you need like a hair tie. You can get it at the dollar store, like a neck scarf, something to go around the rim of the pot if you want. Otherwise, you can plant a plant that has like hanging vines or really big bushy, like think chia pet day. And it's going to look like hair and it's going to look fabulous and phenomenal. And it's the easiest craft and it's so much fun. She's also going to do a Ricky for the people who want to create a more masculine pot. Okay, so we're going to do that. And you'll use your paints over again and all that good stuff. Then on the 12th, we're talking with Dr. John Martin all about the abdominal aortic aneurysms and things going on in his world. We have our hangouts every Thursday at 2. We have another live event. I'm going to be turning that to red today with all of the links with Dr. Jorge Mascaro. He's out of Wisconsin, but he sees patients from 4 states, so 3 surrounding states to where he is. He's a very busy aortic center. We're going to find out how he does it and take all of your questions about aortic disease in general. Molly will be handling your weekend review next week while I'm flying in the plane. And then we have Ask a Doctor event with Dr. Prakash that will strictly be on Facebook. What that means is that Tuesday at 6:30 p.m., his picture will be pinned to the top of Aortic Hope's main page, and you'll have an opportunity to present questions. I'm going to sneeze in the comment section. And just remember, he will be answering those live, and it is a public page. And then actually the Therapeutic Thursday, I think, are coming off due to some family situations. So we might be losing that just for the month of September, although John is very excited to come back on those Thursdays. We have a special hangout that'll happen on the 19th for Aortic Dissection Awareness Day. Caregiver support group meeting, a live Q&A with Dr. Tyler Wallen coming up on the 23rd, another Q&A about Medicare, another Q&A about Lawrence Hope Medical ID Jewelry, another Q&A with Doherty Chella Keenan Associates about disability. This is the most we've ever done in a month, and I'm so excited to have you guys with us on this. So yeah, I think that's about it. Yep, that's what we got. We did it. We made it. Woohoo! Everybody who joined us is going to get a bracelet. Yes.
Hold on. So Donna here says they're having an aortic seminar at one of my surgery heart doctors building on September 19th. This is to help patients to understand about aneurysms, and she's going.
That's awesome. Let's
give it a shout out. Yeah, Donna, where?
What hospital? Please tell us.
Yeah, right. Let's put a shout out.
That's awesome. Yeah, I love when I find out about different places around the country or around the globe that are doing things on the 19th. That's great. I'd love to hear more.
Mm-hmm.
All right, so Josh, you're going to take care of getting in touch with people, right? So that we can get their info so we can send them a bracelet. This is what you're getting. It's a pretty bracelet. It's cute. You know why I love bracelets? I love bracelets. It's hard. This bracelet, if you got up close, basically says Aortic Hope, connecting hearts one beat at a time. I love bracelets because it was a long time ago when I was part of the Crohn's and colitis community, which of course I'm still part of it, but I was just starting to accept the fact that I had a accepted disability according to the ADA. Like, that was hard to say that word in relationship to me because I had lived with this disease for so many years. You just pack an extra set of clothes in case you have an accident. You fight your way through bathrooms. It's a horrible way to live, but you become used to it. There's nothing else you can do. You're taking infusions every 6 weeks. You're giving yourself shots. Some of it's chemo based. So I was at my company. This is pre-dissection, and a woman came in. We were having a Hanukkah fair or festival with vendors, and she came in and she was talking about her son who had been extremely sick. I mean, very, very sick with Crohn's. And as we were talking, I mentioned to her I had it, and she was talking about the Crohn's and Colitis Foundation of America, CCFA, as this major support hub where you could find out where local support group meetings were. And there was no way I was going to a support group meeting because that's just silly. I have a disease. You just deal with it. And then she took her bracelet off, which I like to do. That's why I like to keep a bracelet on me. She took hers off. She handed it to me. And she said, I'm going to be running in the rock and roll marathon in, let's say it was a month later, in a month. And I want you to know that I'm going to be running for you. And she did. She sent me a picture. She used a Sharpie and puts people's names in the community all over her bib and her shirt and everything. And she just handed me this bracelet, and I'm going to be running for you. And it said something like, help Jake help Jake's gut or something like that. And oh my God, I bawled my eyes out. I just never had anybody do anything like that. And she just was handing me a bracelet and it basically said to me, listen, you've got this, but it doesn't have you. And I'm going to do this and I'm raising money for you because it's going to help research additional medications with less side effects and hopefully additional types of treatment plans. And I joined and I went to my first support group meeting. And then I ran in New York. I ran a rock and roll marathon in Vegas. And then 2 months later had a dissection. So that's my story. But my point is now you can have a bracelet. And if you feel inclined, just take it off and hand it to somebody. You will definitely run into people on your path that say they had a family member who had a dissection or they have aortic disease. Take it off and hand it to them. I promise you, you're going to impact their day in a very, very positive way. And that's what I have to say. And now I just rhymed 3 times.
Right on. Donna says this is happening in Greenville, North Carolina. I love North Carolina. North Carolina is a little bit of a paradise.
That's wonderful. Wonderful. Can't wait you should come back and after you attend on the 23rd, join us again and tell us how it was. Tell it what it was like. It's always so great to do these things and get a chance to meet other community members. That's awesome. All right. I have something I have to do. Believe it or not, I do have something I have to do. But it's been so great being here. All of you, please do me a favor. Click like, click subscribe, click the bell so you don't miss out the next time we go live. It's more than just this. We have a lot of things to cover this month, and I'm going to keep giving things away. Could be another set of bracelets, could be car decals, could be a couple water bottles, could be some books, but you got to be here with me in order to do it. And I'm going to tell Molly to do some giveaways too. Okay, so when I'm gone, you'll still have a chance to win some swag this month. So thank you again so much. Josh, you'll take care of the prizes, correct? For me.
I have asked the ladies to email info@aortichope.org.
Thank you. Please send your mailing address to info@aortichope.org. And I will see all of you. Gosh, yes, I'm going to see all of you soon because there's another live event tomorrow. All right, take care. Have a wonderful rest of your week. Bye.